Treatment of high blood pressure in dogs. Dogs can have high blood pressure, and it is often caused by underlying health conditions, such as diabetes or kidney disease. Certain breeds of dogs are more likely to develop health conditions that increase the risk of having high blood pressure. High blood pressure in dogs can cause serious complications, but there are ways to control your dog's blood pressure. When it comes to human health, high blood pressure is a well-known concern. But did you know that your dog can have the same problem? Diagnosing high blood pressure in dogs is tricky, especially since we can't ask dogs how they're feeling. As a result, veterinarians evaluate dogs based on their symptoms. High blood pressure is a serious condition for dogs, and dogs diagnosed with this problem will need treatment and close monitoring. Here's what dog owners should know. High blood pressure, also called systemic hypertension, is when a dog's blood pressure gets too high. The condition is serious and needs to be evaluated, monitored and treated by a veterinarian. Dr. Jamie Wittenberg, DVM, is director of Kingsgate Animal Hospital in Texas and is a veterinary specialist at Senior Tail Waggers. She explains that systemic hypertension refers to high blood pressure that affects a dog's entire body. Measuring a dog's blood pressure identifies the pressure of the blood against the arteries when the heart contracts and relaxes. When the pressure is too high, it can cause complications for dogs. Dogs can have two types of hypertension. Primary hypertension is common in humans, but it is rare for dogs to have this form of the disease. Primary hypertension has no known cause. Secondary hypertension is much more common in dogs and is caused by an underlying disease. According to Dr. Wittenberg, secondary hypertension accounts for almost all cases of hypertension in dogs. The underlying diseases most commonly associated with canine hypertension include kidney disease, Cushing's disease, diabetes, an adrenal gland tumor, pheochromocytoma, obesity, and chronic kidney disease. Some dog breeds may be more prone to have high blood pressure. This is usually because they are more likely to have conditions that cause high blood pressure. Dog breeds at higher risk of developing Cushing's disease are also at higher risk of developing hypertension. These breeds include dachshunds, poodles, terriers. Other dog breeds have an increased risk of diabetes. Dog breeds more prone to diabetes and high blood pressure include Schnauzer, Spitz, Frises de Bichon, Australian Terrier. According to Dr. Wittenberg, common symptoms of high blood pressure in dogs include uncoordinated movements, nosebleeds, blood in urine, persistent dilated pupils, depression, sudden blindness, a head tilt, appearing disoriented, seizures. In the early stages of hypertension, a dog may not show any symptoms. It is also possible to interpret some symptoms, such as vomiting and lack of appetite, as part of a dog's aging process. A veterinarian will place an inflatable cuff on your dog's ankle and inflate the cuff. The vet will then deflate the cuff and use a stethoscope to listen to and measure the sound of your dog's pulsing blood. Checking blood pressure in dogs can be tricky, as many dogs become anxious and stressed in the veterinarian's office. A veterinarian will usually check a dog's blood pressure several times. Taking an average of all the tests can help give a more accurate reading. How a veterinarian treats hypertension in dogs often depends on the condition that is causing it, explains Dr. Wittenberg. Many cases of hypertension resolve completely when the dog's primary disease is controlled, she says. For dogs with persistent hypertension, medications may be indicated. Some veterinarians may recommend restricting the amount of salt in a dog's diet to help control hypertension. There is limited data available on this practice, so it is not known how helpful salt restriction is. But if a dog's kidney disease is causing hypertension, it may be helpful to put the dog on a diet prescribed specifically for kidney disease. Once a dog's high blood pressure is under control, the dog's blood pressure needs to be checked again every 2 to 4 months. These checks help ensure that the dog's blood pressure stays within a healthy range. Most diseases that result in hypertension in dogs are chronic diseases that must be treated and managed for a lifetime, says Dr. Wittenberg. The goal is to alleviate the clinical signs and allow the dog to live a normal, comfortable life. There is no way to estimate how long a dog affected with hypertension will live, says Dr. Wittenberg.